Carol Castellanos. I'm a registered nurse, and today I'm going to explain to you how to perform a head-to-toe assessment to the newborn. As always, the first thing to do is perform the principle-based checklist, including identification of the patient, that in this opportunity is going to be the mother as well as the baby, high hygiene, body mechanics, safety, privacy, and documentation. Okay, the newborn infant physical condition is assessed immediately at the time of the birth. So after appropriate cleaning the baby, we are going to place the baby on the mom's abdomen to encourage bonding and comfort. Then we are going to place the baby under gradient heater unit to clean very well and dry very well the baby, because we want to prevent evaporative heat loss. Then we are going to place a cap to warm the baby a little more, and in this moment is officially the time for assess the baby. So we are going to observe the respiratory effort, color, and muscle tone. If it's necessary, we are going to flick the foot of the baby to stimulate the baby for breathing and crying response. This is called the APGAR score. APGAR. A for appearance, P for pulse, G for grimace, A for activity, and R for respiration. The APGAR score is made at the minute number 1 and minute number 5, and is made to identify difficult breathing or adaptation of the extrauterine life. Each area have a total score of 2 points, from 0 to 2 points, and the total APGAR score has 10 points. Normally babies has 8 to 9 points, and that is perfectly fine. Then we are going to place the baby in a special scale. We are going to use a blanket or paper between the scale and the baby, and the birth weight is an indicator of health. The average of weight of a newborn is 7 pounds in a baby that was born between the 37 weeks to 41 weeks. Then we are going to measure the baby. For this, we're going to use a paper tape. So we are going to measure the head circumference, the chest circumference, abdominal, and length of the baby. For the chest circumference, we are going to use the nipple line, and the normal measure is between 12 to 13 inches. The head is 13 to 15. For the length of the baby, we are going to place the tape from the crown of the baby to the heel of the baby. Okay, also we are going to have the vital signs of the baby. For this, of course, we are going to use a stethoscope. For the apical pulse, because always the apical pulse have to be assessed on a newborn. The normal apical pulse is going to be 120 to 160 beats per minute. The temperature, the first one is going to be rectal, and the normal is 36.5 degrees Celsius. Respirations is 40 to 60 breaths per minute. And then we are going to assess for the general appearance. We are going to check for posture, level of consciousness, physical activity, symmetrical positioning, which help you to determine if there was any trauma at the moment of birth. Also, we are going to check for the skin of the baby, for color, texture, the nails of the hands, the nails of the feet, and the presence of rasher, Mongolian spots. But it's pretty important to consider the ethnicity heritage of the baby. Okay, the head, we are going to palpate the head, and it's pretty important the shape, the presence of molding, and it's super important to palpate the fontanelles. That should be soft, the anterior and posterior. If the fontanelle is depressed, it's indication of hydration. If it's bulging, it's indication of intracranial cranial pressure, hemorrhage, or bleeding. So that is pretty important to report, of course. Also, the skin, we need to see for acrocyanosis, that is blue color in the hands and the feet. It is perfectly normal. It's going to disappear when the baby is gonna cry or after a few hours of the birth. Also, we are going to check for petechiae, in the face, erythema, Mongolian spots in the back of the baby. All are normal findings. Okay, now we are going to assess for the eyes, nose, mouth, and ears. First, the eyes. The eyes should be symmetrical, not discharged. When the baby is crying, tearless, and also swollen around the eyes is completely normal because the process of the birth. Then, and nystagmus is completely normal. This is the movement of the eyes, uncontrolled movement of the eyes, and it's completely normal, and it's going to disappear in the following weeks. Now, the nose should be in the midline. We are going to check for patency. So using the thumb, we are going to press the chin for closing the mouth, and with the index, we are going to close a nostril. Then we are going to check for chest movement. In this way, we can know that the patency of the nose is positive. And we are going to repeat the same process with the other nostril. Okay, now we are going to use a clean glove to assess the mouth. So first we are going to check around the mouth for bluish color, which is indication of respiratory distress. And this is circummoral cyanosis. And that is not a good thing. If the baby has the bluish color around the mouth, we need to help the baby immediately. Okay, so we are going to use the clean glove to check for the tongue, for color, for symmetry, and free movement. Also, we are going to check the gums for pink color. The baby should not have teeth. Then we are going to introduce a finger and palpate the palate to assess for a cleft palate. Then we are going to check for reflexes. The first one is suck reflex. So we are going to introduce the finger and wait until the baby suck the finger. Then the gag reflex, we are going to introduce the finger farther toward the throat to stimulate the gag in the baby. And finally, the rooting reflex. So we are going to touch the cheek of the baby. So he is supposed to move the head toward that side. Okay, now we are going to assess the thorax and the arms. But first, we are going to start with the chest. The normal shape of the chest should be like a barrel. You want to see also diaphragmatic respirations, but be sure of the absence of intercostal retractions or substernal retractions. Then we are going to move to the clavicle. To assess the clavicle, we are going to palpate, and also at the same time, we are going to rotate the arm while you're palpating. To assure for the clavicle intact, crepitus should be absent. Also, if the baby has a high pitch when crying, it could be an indication of a broken clavicle and of course of pain. You have to do this by bilaterally, and also you have to check the palms of the baby. Check the creases. If there is presence of simian crease, it's an indication of Down syndrome. Also, we have to count the digits or fingers. Also, we are going to palpate one at a time the brachial pulse. And also, we are going to assess for grab reflex by placing one finger in the palm of the baby, and immediately the baby is gonna grab your finger. and that is a good indication, of course. Okay, again, we are going to look for the color of the hands and the feet. As I already told you, that is acrocyanosis, when the hands and feet are bluish color. Is a normal finding, and it's gonna disappear in the next hours after birth, or it's gonna disappear when the baby cries. Now we are going to assess for the nipples. It should be symmetrical, pink color, and well formed. Now we are going to osculate using a pediatric stethoscope. The normal heart rate is 120 to 160 beats per minute. Always in a newborn, we are going to assess for the apical pulse, and we are going to place the stethoscope, remember, in the 4th and 5th intracostal space at the left mid-clavicular line. We are going to listen for a full minute, and also we are going to listen for the 5 heart sounds. The aortic, pulmonic, tricuspid, the Erb's point, and the mitral. Right here also we are going to listen for the respiratory sounds. We are going to listen bilaterally, the right upper, left upper quadrants, the mid and the lower right and lower left. We want to have clear lungs, free of crackles and wheezes, because if we have those sounds, it's indication of fluid in the lungs. But be aware, because we don't have to have absence of sounds in the lungs, because could be indication of atelectasis. Okay, now is the time for the motor reflex. You can do this in 2 different ways. One is you can hit hardly, not too much, the bed of the table where the baby is, or you can lift the baby gently and pull the baby up, but the head should touch still the bed, and then release. So the baby is gonna make like a C shape with the hands, and also the baby is gonna pull out the legs with both different strategies. That one is the more reflex. Now we are going to assess the abdomen. Should be rounded, not distended, no shiny or taut skin. Then we are going to osculate the vowel sounds, and we are going to start by the right lower quadrant, then the right upper, left upper, and left lower quadrant. Also, we are going to palpate gently the liver, and then we are going to inspect the umbilical cord. We should have 2 arteries and 1 vein. Should be clean, odorless, and clamped. And the umbilical cord should have pulse at the moment of the birth, and that is completely normal. It's gonna happen for the first minutes of life. Then we are going to inspect the genitalia, which normally is swollen because the breathing process or hormones levels from mom. Also, we are going to check for the patency of the anus by paying attention of the passing of meconium, which is the first bowel movement that the baby has during the first 24 hours after birth. If you have a girl, the labia majora should be bigger than the labia minora. If you have a male, you have to check for both testes. If those are descended into the scrotum, so you have to palpate the testes, and those should have the size of a marbles. The urinary meatus should be at the tip and the middle. No deviation should be present, like hypospadias or epispadias. Then we are going to place the baby in front of you like I have it right now, and we are going to check for the extremities. They should be symmetrical. Then we are going to palpate one at a time the femoral artery, because if we press both at the same time, we are going to stimulate the vagus nervus. Then we are going to check for the Babinski reflex by drawing a C shape from the sole of the foot to up, so the baby should fan the toes out. We are going to do this bilaterally too. Also, we are going to check for the plant's grip by placing the finger under the toes of the baby, so the baby with the tiny fingers are gonna like grasp your finger. Right here in this moment, you are going to place the identification band under the ankle, and also the baby has to have another one on the hand, and be sure that those ID bands are the same one like the mom's. That is pretty important. Then we are going to gently turn the baby over to inspect the back. We are going to palpate the vertebra for placement, the midline, also very symmetrical, and check for the spina bifida, and also for Mongolian spots that I already told you are completely normal. Also, we are going to inspect the folds of the skin. In this way, we can know what is the condition of the hips. So if the folds are symmetrical, everything is perfectly fine. Talking about the hips, we are going to perform the Ortolini's and Barlow's test by placing the middle finger along the femur. We are going to flex the extremities 90 degrees and pay attention for any click. This helps us to assess for any dysplasia of the hips. Finally, we are going to place the diaper back. Be sure that the ID bands are in place, and grab the baby nice and comfy, comfort the baby in the arms of the mom.